Smart Medicine, brought to you by Christus Cabrini Hospital.
Dr. James Parrish joins us today. He is a bariatric surgeon. We are concentrating on taking care of your heart, but if you're carrying around a lot of extra weight, that is doing harm to your heart.
Right. Well, that puts a tremendous strain on your heart. So it leads to things like congestive heart failure or CHF, and then also with obesity, it really affects all the risk factors of heart disease. So things like diabetes, high blood pressure, high cholesterol, those are all affected by obesity. So if we can help the weight, we can get rid of those risk factors and maybe prevent heart disease altogether.
And I tell you what, you are talking to people that are at their rope's end. They have tried every diet in the world, and it just does not work.
That's right. People usually come to us after a lifetime of trying to lose weight and being unsuccessful. So when they come to us, this is really kind of a last resort, but it's one that works, and they can get long-term results with it.
And there are different types of surgery that you can perform.
We do mainly the sleeve and the bypass, and they each have their benefits and what's good and bad about each one. And they're all laparoscopic, so they're tiny little incisions. In general, it's about 1 day in the hospital, and most people take about a week off of the ward.
That's incredible. And a lot of folks that were on medication coming into the hospital before surgery leave the hospital
on much less or sometimes none. Especially in the case of diabetes, often people come in on quite a bit of, say, insulin and go home on absolutely nothing.